Hello, I am Dr. Shyam Aggarwal, Head of the Department of Medical Oncology at Sir Ganga Ram Hospital. Today, I'll try and explain the genetic testing which is being performed for patients who are suffering with a variety of cancers. We have evolved in the last 15 to 20 years. 20 years ago, if we were to do a gene mapping or gene testing of any cancer, it would cost several lakhs and it would take several months. But now, with the availability of tools like next generation sequencing and ddPCR, we are able to perform these genetic tests on tumor tissue, and the report is available to us within 10-15 days at a price of 15,000 to 2 to 3 lakhs. Not only that, if somebody has difficulty in giving the tissue, you can even do liquid biopsy, which means that you can take the blood sample of that patient and put it into the machine and get the gene mapping of that cancer from that particular individual. Now, the cost, as I said, varies from a few thousand to a few lakhs. How does the doctor decide as to what test has to be done? So, what has happened is that lung cancer is the poster boy for gene testing in cancers. Lung cancer, you have 10 to 15 genes which are commonly abnormal, and we have drugs against these 10 to 15 genes. So therefore, a lot of laboratories have developed a 10, 15, 20 gene panel test, and therefore the cost of that test is less, because if you were to do a comprehensive gene profiling with using, say for example, 300 or 350 genes, then the cost goes beyond 1 lakh to 2 lakhs depending upon the lab. That information may not be useful because you do not have drugs beyond 10 to 15 genes. So that is the biggest limitation in performing a 350 or a 400 gene panel testing. Similarly, for colorectal cancer, we need a smaller gene panel in which we can have KRAS, BRAF, HER2 and a few other genes. In the lung cancer, the genes which are included are EGFR, ALK, ROS, NTRK, BRAF, KRAS and so on. So the problem with this comprehensive gene profiling is that we are able to figure out that which genes are abnormal in a given patient with cancer. Unfortunately, we have drugs only to target up to 20 or 30 genes. So even if we were to find out which gene is abnormal, we don't have drugs. The second area in the genetic testing is the germline testing. So this is a little technical. Germline testing means the testing of genes which we inherit from our parents or from our grandparents. And this is common in cancers like breast cancer, ovarian cancer, where BRCA1, 2 genes are usually tested. There are certain other genes, for example, PALB2, CHEK2, RAD51, etc. So which can be transmitted from your parents to the patient, but the incidence of that is much lower. But they gain importance because we have medicines to target BRCA1 and BRCA2 and PALB2 gene. This test only requires a simple blood investigation. However, it can be done in the tissue as well. But then, you can do the germline testing. And like for breast and ovarian cancer, there are more than 90 genes. Some labs are reporting. But unfortunately, the drugs are not there. So you have to be selective. You have to go to a genetic counselor in order for you to decide which germline genes should be tested in a particular individual. For example, in colon cancer, we are looking at MSI or MLH genes, which can be abnormal in colorectal cancer. So you have to select out depending upon the type of cancer and not perhaps go blindly into these testing. Final thing is that there is a mushrooming of labs across our country to perform these tests. So validation of these tests is very important. So one has to go through a proper drill to report the validation and seek the lab clearance, and you need to look at the data before you select the lab for ordering these expensive tests, because the abnormality in the gene is going to dictate the treatment, and on that the life of the patient will depend. Thank you very much.